It's 94.3 WYBC. I'm Darryl Huckaby with DeDe In The Morning with a special guest to enlighten us today. Her name is Maritza Bond. She is the director of the New Haven Department of Public Health. And we're going to talk about COVID. Good morning. How are you today?
Good morning. Thank you. I'm well. How are you?
So fantastic. I'm feeling great. So glad to have you back to give an update as to where we stand with COVID. I know the numbers have been slightly increasing, but give us a snapshot of where we are as a community here in the Elm City.
Yeah, no, I'm happy to be back. And as you know, we continue to work as a community to ensure that people are getting vaccinated. Right now, when we're looking at monitoring the cases in our city, we're starting to see just a slight uptick in cases. We saw about a 20% increase from last week. So we're averaging about 200 cases within a 2-week period. And so we just want to ask people to be vigilant. It is important to know that right now, most of our positive cases are really now BA2, which is AKA Omicron's cousin. Okay. And so we want to just inform people that we are now facing a new variant, which is a subset of the Omicron that we were hit earlier this winter.
How is that compared to the original Omicron?
Right now, people are reporting mild symptoms, especially those that are vaccinated, are recuperating quickly. And so if you're not vaccinated, we want to urge you to get vaccinated. We have ample supplies throughout the city, offering them 7 days a week in partnership with Griffin Hospital and our community health centers. And so we just want to encourage people to be vigilant. You know, if you're going to be socializing, which is optional, using discretion to reduce any large gatherings and making sure you're wearing a mask if you are going to be less than 6 feet, and hand washing as much as possible. We know that these are proven strategies to help us stay healthy.
Now, I've noticed that, and I'm always giving a PSA whenever I talk about COVID because I know the numbers are rising. And my thing is that COVID is still here. So it's still in the streets. It hasn't gone anywhere, although people are beginning to feel comfortable going back outside, which they should, but don't drop your guard completely. So I'm a big advocate of still wearing a mask in crowded locations, even when I go indoors. We don't have the indoor mask mandate, but we still do have the mask mandate within our school system, correct?
Correct. We still have them in our municipal buildings, and school is not an option. So we want to protect our children and protect our workforce, and want to commend the community for really responding for that ask. Majority of the community attended a Board of Ed meeting last Monday, and were asking us to keep the mask mandate in our school system. And I commend the community for taking that stance and making my recommendations easier. And, those that are ready for mask optional, remember that you have a choice and you can work with your school community and to see what the best learning option is for your child. And so it's important that we work collectively together. One of the things that you mentioned about our situational awareness, like where we are also seeing our hospital cases going up. We saw 36 patients currently hospitalized through our Young New Haven system. And so that was about 56% increase. And so when we're looking at our positivity rate, we're looking at our sewage data, we're looking at our PCR data, and we're also looking at hospitalizations. And I just want to remind the community that we're not able to monitor rapid tests that are done in local clinics, or we are not able to get your results when you take a test at home. So we really rely on our sewage data and our hospitalizations as two major indicators on how we're doing as a community.
Now, people don't seem to, even if you catch it these days, people don't seem to be getting severe symptoms or as severe as in the past. So I think there's a comfortability level within our community that even if I catch it, I'm not going to be harmed as much as maybe or as likely as, last year or 2 years ago even. But let's talk about the long COVID, because you can catch it and make it through it with, minor scars, so to speak. But, there are individuals that are getting long-term symptoms that recur that they can't get rid of.
Absolutely. And that's so critical. And I think the people don't think about the aftermath. So some people are like, I just rather take the risk and get COVID because I'm a healthy individual. And you're taking a really significant risk for two reasons. And you hit it right at the nail, right? Long COVID. There are now new published data out there indicating that 4 out of 10 people that have survived from COVID develop long-term post-COVID conditions. And we need to make sure that we do not impact our bodies long-term because we are lacking the ability to take the necessary precautions. And so, we want to urge the community to not put yourself at risk of having these long-term effects that we don't know yet. As we're continuously learning from science of what the side effects are beyond that initial, disease period. And we want to just be mindful that we are also impacting those that have compromised systems. That can be our family members, our loved ones that may have an immunocompromised situation, a medical condition. And so our mild COVID can be detrimental to a loved one. And we also have to be responsible as a community.
Exactly. Which is why we need everybody to get vaccinated, get the first booster, get the second booster, and then our children, make sure that they're vaccinated as well, correct?
Yeah, absolutely. We kicked off a youth campaign, and I just want to commend and shout out to all the children that participated in the Brady Bunch commercial. We did a youth initiative of children in our district, and it's really important to do peer-to-peer education. Our vaccinations amongst adolescents is still low. So we want to encourage parents, if you have questions around the efficacy of the vaccine and making sure that your child's going to be safe, we have information on our city website. You can also call the health department and speak to a clinician so that you can be able to have your questions answered. But most importantly, you can talk to your pediatrician. Your pediatrician has been with you and part of your family's care. And so being able to have open dialogue on the importance of getting vaccinated. And as a parent myself, I know that you question everything and you have the right to do that because you want to make sure that you're protecting your children and or you're, as a caregiver, protecting the child that you're taking care of. And so I just want to urge parents to gain the knowledge that's necessary so we can be able to also protect our children.
Awesome. And again, we're talking to Maritza Bond. She's the Director of Public Health here in New Haven. Can you give the website information for people?
So it's the newhavenct.gov.
Very good. newhavenct.gov. Well, Maritza, thank you so much for joining us again today. We're going to have you back on to give, periodic updates. And, hopefully, I'm claiming that our community will come together and be very diligent because the virus is still in the streets. Don't drop your guard down all the way. Be frugal in what you do and who you're around. And, especially if you're in crowds indoors, make sure that you protect yourself, which in turn is protecting your family and the community.
Yeah, and we're doing so well as a city, and let's continue to do that. And listen, I love the New York Giants over there. I see your hat.
No doubt. I always represent the G-Men.
Represent.
No matter how bad they can be, I'm a diehard.
That's right. Me too. Take it easy.
Maritza Bond, Director of Public Health for the City of New Haven. Thank you so much for joining us. I'm Darryl Huckaby with DeDe In The Morning on 94.3 WYBC.